The surgical blade was inches from the wrong artery when her phone buzzed. Dr. Marcus Hale didn't even look up. Just another interruption from another nobody nurse. But the voice on the other end didn't ask for him. It demanded someone else. Someone whose name made the hospital administrator go white. Someone who wore scrubs to hide combat medals. Someone Marcus had humiliated in front of the entire trauma department exactly 47 minutes ago. The encrypted line crackled with two words that changed everything. Lieutenant Bishop to us. And just like that, the joke wasn't funny anymore. If you want to see how a single phone call can flip an entire hospital upside down, stay with me until the very end. Like this video, and drop a comment telling me what city you're watching from. I want to see how far this story travels. The blood on Marcus Hale's shoes was still wet when he started talking. You know what separates competent surgeons from mediocre nurses? He didn't wait for an answer. Never did. About 8 years of education and the ability to make decisions that actually matter. Scattered laughter rippled through the break room. Uncomfortable, half-hearted, the kind people offer when they're not sure if they should. Lieutenant Sarah Bishop kept her eyes on the medication cart she was restocking. Her hands didn't shake. They never did anymore. Not after Kandahar, not after Mosul, not after watching a 19-year-old bleed out in her arms while mortars turned the sky orange. But nobody at Riverside General knew about any of that. They just knew she was quiet. Too quiet, some said. The kind of quiet that made people like Marcus Hale think she was weak. I'm just saying, Marcus continued, leaning against the counter with the casual arrogance of someone who'd never been told no. When someone barely scrapes through a state college nursing program, maybe they shouldn't question a Columbia-trained surgeon's judgment, especially in front of residents. Sarah clicked the medication drawer shut. The sound was sharper than she intended. The dosage was wrong, she said. Not loud, not aggressive, just factual. 70 kilograms, renal impairment, that protocol calls for half the loading dose you ordered. Marcus smiled, the kind that didn't reach his eyes. And you calculated that how? WebMD? More laughter, louder this time. I followed the hospital formulary, Sarah said. Same one you're supposed to use. Supposed to? Marcus pushed off the counter. I've been practicing trauma surgery since you were probably still deciding between community college and cosmetology school. I don't need a checkbox nurse telling me how to do my job. Sarah's jaw tightened. Just barely. Just enough. I wasn't telling you how to do your job. I was keeping a patient from going into acute renal failure. The break room went silent. Marcus's smile vanished. You want to play pharmacist? His voice dropped. Dangerous now. Fine. You can handle medication reconciliation for every admit tonight. Alone. All 12 beds. Should keep you busy enough to stay out of my way. He walked past her, close enough that his shoulder nearly brushed hers. Close enough to make sure everyone saw who had won. And Bishop? He stopped at the door. Next time you want to embarrass me in front of my team, make sure you've actually earned the right to speak. The door swung shut behind him. Nobody looked at Sarah. They just gathered their things, mumbled about getting back to rounds, scattered like roaches when the lights come on. Sarah stood alone in the fluorescent buzz of the break room, staring at a coffee stain on the counter. She'd seen worse disrespect. She'd survived worse men. But something about the casual cruelty, the way Marcus could humiliate her and then just walk away like it was nothing, like she was nothing, made her think about things she'd buried for a long time. Things like the Bronze Star tucked in a box under her bed. Things like the battlefield commendation she'd never shown anyone. Things like the screaming soldiers she'd held together with her bare hands while Apache helicopters circled overhead, and someone radioed that medevac was still 8 minutes out and she'd whispered, "You're not dying today," over and over until she almost believed it herself. But that was a different life, a different Sarah. Here, she was just a nurse. Quiet, forgettable, easy to dismiss. She grabbed her tablet and headed back to the trauma floor. Like, the Riverside General Trauma Department never really slept. It just shifted. Different faces, same chaos, the endless rhythm of broken bodies and desperate interventions. Sarah moved through it like a ghost, checking vitals, adjusting IV drips, catching mistakes before they became catastrophes. At 11:47 p.m., she stopped a resident from administering Dilaudid to a patient with a documented opioid allergy. At 12:23 a.m., she noticed a post-op patient's urine output had dropped and flagged early sepsis before anyone else saw the pattern. At 1:15 a.m., she held the hand of a woman whose husband had just died and didn't say anything because there was nothing to say. Nobody thanked her. Nobody noticed. By 2 a.m., Marcus Hale was deep into an emergency splenectomy, 3 residents watching him work with the reverent silence of disciples at an altar. The patient, a 26-year-old motorcyclist named David Chen, had arrived 90 minutes earlier with blunt force trauma and internal bleeding that painted his abdomen black on the ultrasound. Sarah wasn't scrubbed in, wasn't even in the OR. She was 2 floors down, finishing the medication reconciliation Marcus had dumped on her out of spite. She almost didn't hear the commotion. Almost. But trauma floors have a specific sound when something goes wrong, a frequency of panic that cuts through everything else. Sarah looked up from her tablet just as Dr. Nina Reeves, one of the senior residents, burst through the stairwell door. "We need blood. Now. 4 units O negative. Chen's pressure just tanked and we can't find the bleed." Sarah was already moving. "What happened?" "I don't know." Nina's voice cracked. "Hale said the spleen was the source, but we removed it and he's still bleeding. Pressure's dropping, saturation's at 86. Did anyone check for retroperitoneal bleeding?" Nina stopped, blinked. "What?" "Retroperitoneal," Sarah repeated, "behind the abdominal cavity. Blunt force trauma from a motorcycle crash. If he hit the handlebars on the left side, he could have a lumbar artery tear. It wouldn't show up on the initial imaging, and you wouldn't see it during a standard splenectomy approach." Nina stared at her. "How do you—" "Just tell Hale to check," Sarah said, before Chen dies." Nina hesitated, just for a second. Then she was running back toward the OR. Sarah stood in the hallway listening to her own heartbeat. She'd seen that injury pattern 17 times. 16 of them had died before anyone realized what they were looking at. The 17th had lived because Sarah had recognized it in time, but that was in Helmand Province, not a sterile American hospital. That was when people listened to her. She went back to her medication card and tried not to think about David Chen bleeding out 2 floors above her. At 2:47 a.m., Marcus Hale found the lumbar artery tear. He didn't announce where the idea had come from. Didn't mention Nina's suggestion. Certainly didn't credit the quiet nurse who'd diagnosed it from 2 floors away. He just repaired the vessel, stabilized the patient, and walked out of the OR like a conquering hero, while residents whispered about his surgical intuition and clinical instinct. Sarah heard about it third-hand from a nurse's aide. She didn't say anything. What was there to say? She'd learned a long time ago that some battles weren't worth fighting, that sometimes survival meant staying quiet, staying invisible, staying alive. At 4:30 a.m., she was finishing her charting when the charge nurse, a tired woman named Patricia who'd worked at Riverside for 23 years, stopped by her station. "Heard you called the retroperitoneal bleed," Patricia said quietly. Sarah glanced up. "Nina called it." "Nina said it came from you." Sarah went back to her computer. "Patient stable. That's what matters." Patricia didn't move, just stood there, studying her with the kind of exhausted wisdom that came from decades of hospital politics and broken promises. "You know what your problem is, Bishop?" Sarah's fingers paused on the keyboard. "You're too good at making other people look smart." Patricia walked away before Sarah could respond. The words sat heavy in the empty corridor. Sarah closed her eyes, took a breath, opened them again. Outside the windows, Langston City was starting to wake up. Distant car horns, early morning delivery trucks, the muted glow of streetlights fading into dawn. Somewhere out there, David Chen's family was probably getting the call that he'd survived, that the surgery had been successful, that Dr. Marcus Hale had saved their son's life. Nobody would mention the nurse. They never did. Sarah logged out of her computer and grabbed her bag. Her shift was over. She was halfway to the parking garage when her phone buzzed. "Mass casualty incident. All available trauma staff report immediately." Sarah turned around. The exhaustion evaporated like steam. Her body shifted into a different gear, the one that had kept her moving through 72-hour combat rotations, the one that had made her legendary among the soldiers who'd bled under her hands. By the time she reached the trauma bay, it was already controlled chaos. "What do we have?" she asked a nearby paramedic. "Training convoy," he said, voice tight. "Military. Rolled over on Highway 49 about 40 minutes ago. Multiple casualties, mix of blunt and penetrating trauma, and he hesitated. It's classified. Federal oversight. They're sending someone. Sarah felt something cold settle in her chest. Military convoy, classified casualties, federal oversight. She'd lived this before, just on the other side of the world. Marcus Hale strode into the trauma bay like he was walking onto a stage, residents trailing behind him. He started barking orders, assign teams, prep ORs, get imaging ready, all the right moves, textbook disaster response. But Sarah saw what he didn't. The paramedics were nervous, not normal pre-hospital jitters. Something else. The police officers stationed by the entrance weren't local, federal badges, serious faces. And the first stretcher that came through the doors carried injuries that made Sarah's breath catch. Blast pattern burns, shrapnel wounds, the specific kind of trauma that came from explosive decompression in an armored vehicle. She'd seen it before. Too many times. Marcus was already moving toward the patient, calling out orders, taking command. That's when the doors opened again, and everything stopped. The man who walked in wore a dark suit and carried a tablet with a Department of Defense seal. He had the kind of presence that made rooms go quiet, not from fear, but from the sudden weight of authority that couldn't be argued with. "I need the ranking trauma specialist," he said. No preamble, no introduction. Marcus stepped forward. "Dr. Marcus Hale, Chief of Trauma Surgery. I'm leading the response." The man glanced at him, then looked past him. "I need Lieutenant Bishop." The trauma bay went absolutely still. Marcus blinked. "I'm sorry?" "Lieutenant Sarah Bishop." The man's voice didn't change, didn't rise, didn't need to. "I was told she's on duty tonight." Every eye in the room turned towards Sarah. She stood frozen by the supply cabinet, her heart suddenly hammering against her ribs. "There's no—" Marcus started. "I'm here." Sarah's voice cut through, steady, clear. The man's eyes found her. Something like relief crossed his face. "Lieutenant, we have a situation." Marcus looked between them, confusion giving way to something else, something defensive. "I don't understand," he said. "Bishop is a nurse. She doesn't have—" "Bishop is a decorated combat medical officer with 3 tours in active conflict zones," the man said, still not looking at Marcus. "She has more battlefield trauma experience than anyone in this building. And right now, that's exactly what we need." The room tilted. Patricia's eyes went wide. Nina's jaw dropped. Marcus stood there like someone had just spoken a foreign language directly into his brain. Sarah felt the walls closing in. All those years of staying quiet, of being invisible, of letting people underestimate her because it was easier than explaining, of burying Lieutenant Bishop so deep that sometimes even she forgot she existed. All of it, gone in a single sentence. The man stepped closer, lowered his voice. "We have 5 casualties inbound, 4 stable, 1 critical. The critical case has injuries consistent with IED exposure, complex penetrating trauma, suspected retained foreign bodies, possible compartment syndrome. We need someone who's seen this before, who knows what to look for, who won't freeze when it gets bad." Sarah's mind was already working, already categorizing, already shifting into the version of herself she'd locked away. "Blast radius?" she asked. "Approximately 6 meters. Vehicle armor contained most of it, but the driver took the worst of it. Conscious?" "In and out. GCS of 9 when we loaded him." Sarah nodded, turned to the supply cabinet, started pulling trauma packs with practiced efficiency. "I need a CT suite on standby, 2 units of O-negative ready to push, and someone who can do a proper fasciotomy if we're dealing with compartment syndrome. Also," she glanced at the paramedics, "tell the incoming teams to mark any suspected foreign bodies before they move the patient. We can't risk shifting shrapnel." The man smiled, grim but genuine. "Good to have you back, Lieutenant." Sarah didn't smile. She just moved. Behind her, she could hear Marcus trying to reassert control, trying to insert himself back into the situation. But his voice sounded distant now, irrelevant. The military casualties arrived 6 minutes later, and Sarah Bishop, quiet, forgettable, easy to dismiss Sarah Bishop, stepped into the chaos like she'd never left. The first stretcher carried a young sergeant with penetrating chest trauma. Sarah assessed him in seconds, Entry wound below the clavicle. No exit. Diminished breath sounds on the right side. Pneumothorax. Maybe hemothorax. Chest tube, right side, fifth intercostal space, she said. A resident moved to comply. Second stretcher. Specialist with a mangled left arm. Arterial bleeding controlled but extensive soft tissue damage. Vascular surgery consult OR2. Get him typed and crossed for 6 units. Third stretcher. Corporal with facial burns and suspected inhalation injury. Airways compromised. Intubate now. Don't wait for swelling. She moved between patients like water, her voice calm and absolute. No hesitation, no second guessing. This was who she'd been before Riverside General, before the quiet, before the invisibility. Marcus stood at the edge of the trauma bay watching her work. His expression was unreadable, somewhere between shock and something that might have been anger, or maybe just the slow realization that everything he thought he knew had just been wrong. The critical case came last. Staff Sergeant Michael Torres, 29 years old. Blast trauma to the lower torso and legs. Blood pressure barely sustainable even with pressors. Pupils sluggish, skin pale and cool. Sarah looked at him and saw a dozen other faces. A dozen other soldiers. A dozen other moments where she'd been the last line between life and death. Get him to Trauma 1, she said. I'm scrubbing in. Marcus finally found his voice. Bishop, you're not a surgeon. No, Sarah said, not looking at him. I'm a combat medical officer trained in forward surgical team protocols. I've done damage control surgery in conditions you can't imagine. And right now, Sergeant Torres doesn't need a surgeon. He needs someone who's seen this before and lived to tell about it. The DoD representative stepped forward. Dr. Hale, Lieutenant Bishop is operating under Federal Emergency Medical Authority for the duration of this incident. Your cooperation is appreciated, but not required. The words hung in the air like a verdict. Marcus's face went red, then white. But he didn't argue, couldn't argue. Sarah was already moving toward the scrub room, her mind running through the procedures she'd performed in dust-choked field hospitals and makeshift surgical tents. The muscle memory came back instantly. Every cut, every clamp, every desperate save. She scrubbed in silence, watching the betadine turn her hands orange-brown. When she walked into the OR, Sergeant Torres was already prepped. The anesthesiologist looked up at her, eyes uncertain. Ready when you are. Sarah took her position, took a breath, and cut. The surgery lasted 4 hours. 4 hours of controlled chaos, of finding bleeding vessels in mangled tissue, of removing shrapnel fragments so small they barely showed up on imaging, of repairing damage that shouldn't have been survivable. Marcus watched from the observation gallery for the first hour. Then he left. Sarah didn't notice. She was too busy keeping Michael Torres alive. At one point, she found a piece of metal lodged against his femoral artery, millimeters from catastrophic hemorrhage. She'd seen that exact injury pattern in Kabul, knew exactly how to extract it without nicking the vessel. The resident assisting her stared. How did you know it was there? Sarah didn't answer, just kept working. When she finally closed, Torres's vitals were stable. Not great, but stable. Alive. She stepped back from the table, peeled off her gloves, and felt the adrenaline start to drain away. The OR nurse touched her arm gently. That was incredible. Sarah just nodded. She walked out into the scrub room, stripped off her surgical gown, and stood under the fluorescent lights feeling like she'd just run a marathon through her own past. The DoD representative was waiting outside. Sergeant Torres is going to make it because of you, he said. He's going to make it because he's strong, Sarah replied. That too. The man handed her a tablet. I need you to sign off on the casualty reports. Federal protocol. Sarah scanned the forms. Her name was listed as primary surgeon. Her rank, Lieutenant, U.S. Army Medical Corps, was right there in black and white. No more hiding, no more quiet. She signed. When she looked up, half the trauma department was standing in the hallway, staring at her like she'd just sprouted wings. Patricia was crying. Nina looked stunned. And Marcus was nowhere to be seen. Sarah handed the tablet back. Where's Dr. Hale? She asked. The DoD representative's expression didn't change. In a meeting with hospital administration, they had some questions about protocol compliance and staff conduct. Something in his tone suggested those weren't the only questions being asked. Sarah felt a flicker of something she couldn't quite name. Not satisfaction, not revenge, just the quiet certainty that sometimes, eventually, the truth comes out, whether you're ready for it or not. She walked back to the trauma bay. There were still patients to check on, still charts to update, still work to do. But when she passed the break room, the same break room where Marcus had humiliated her just hours earlier, she caught her reflection in the glass door. And for the first time in a long time, she recognized the woman staring back. Not Sarah Bishop, the nurse. Not Sarah Bishop, the invisible. Lieutenant Sarah Bishop. Combat medical officer. Lifesaver. Survivor. The woman who'd never needed anyone's permission to be exactly who she was. She just hadn't realized it until someone called her by her rank. Dawn was breaking over Langston City when the last ambulance pulled away. The trauma bay slowly emptied. The chaos settled into the familiar hum of a hospital catching its breath. Sarah stood at the nurse's station, updating patient files, when Patricia approached. "They're saying Marcus is being investigated," she said quietly, "for the medication incident, and apparently some other complaints that just surfaced." Sarah didn't look up from her computer. "That's not my concern." "Maybe not, but it's justice." Sarah's fingers paused on the keyboard. "Justice is Sergeant Torres waking up tomorrow. The rest is just noise." Patricia smiled, sad and knowing. "You really don't care about the glory, do you?" Sarah finally met her eyes. "I care about the work. Everything else is just ego." She finished her charting, grabbed her bag, and headed for the exit. The sun was fully up now, painting Langston City in shades of gold and shadow. Somewhere in the building behind her, Marcus Hale was probably realizing that his reputation couldn't protect him from his own actions. That the quiet nurse he'd dismissed was the one person in the hospital the federal government trusted most. But Sarah wasn't thinking about him. She was thinking about Michael Torres, fighting for his life in the ICU. She was thinking about the soldiers she'd saved and the ones she hadn't. She was thinking about the strange, terrible beauty of being invisible until the moment when invisibility was no longer an option. Her phone buzzed. A text from an unknown number. "Lieutenant Bishop, DOD liaison here. Pentagon wants to discuss something with you. Can you call when you have a moment?" Sarah stared at the message. Then she put her phone away and kept walking toward her car. Whatever came next could wait. Right now, she just wanted to go home. To sleep. To remember what it felt like to be quiet again. Even if quiet would never quite mean the same thing anymore. But quiet found her anyway. Sarah's apartment was a third-floor walk-up in a converted factory building on the east side of Langston City. The kind of place where the heating clanked through old pipes and the neighbors were either grad students or musicians who kept strange hours. She liked it because nobody asked questions. Nobody cared who she was or where she'd been. She dropped her bag by the door and stood in the middle of her living room, still wearing scrubs that smelled like antiseptic and fear. The silence felt wrong. After 4 hours of surgery, after the chaos of the trauma bay, after holding Michael Torres's life together with her bare hands, the quiet pressed against her eardrums like water. She pulled off her scrubs and stood in the shower until the hot water ran cold, watching pink-tinged water circle the drain. Blood from the surgery. Always some blood, no matter how careful you were. When she finally crawled into bed, her phone was buzzing again. 15 missed calls, 23 text messages. She turned it off and pulled the blanket over her head. Sleep came hard and left early. Muisits. By the time Sarah walked back into Riverside General that evening, the story had already spread like infection through every department, every floor, every break room. The nurse who was actually a decorated combat officer. The woman Marcus Hale had humiliated, who'd then saved 5 military casualties while he watched from the sidelines like a spectator at his own irrelevance. People stared, not the way they used to, right through her, like she was furniture. This was different, uncomfortable, the kind of attention that made her skin itch. A respiratory therapist she'd never spoken to smiled at her in the hallway. "That was amazing what you did." Sarah nodded and kept walking. A physician assistant stopped her near the elevators. "I heard you operated on that sergeant. 4-hour damage control surgery?" 3.5, Sarah said. "Still, that's incredible." Sarah pressed the elevator button twice. It didn't make it come faster. She'd been at Riverside General for 14 months. In all that time, maybe 6 people had spoken to her outside of work-related necessity. Now everyone wanted to talk, to congratulate her, to tell her how impressed they were. It felt like standing naked in a room full of strangers. The trauma floor was quieter. Most of the day shift had gone home, leaving behind the skeleton crew that kept the department breathing through the night. Sarah checked the board. 2 patients in holding, 1 post-op, the rest stable. Sergeant Torres was still in the ICU. Critical, but stable. Those words never meant as much as people thought they did. Patricia was at the nurse's station, reading through charts with the focused exhaustion of someone near the end of a double shift. "You came back," she said. "I worked tonight." "You could have called out. Nobody would have blamed you." Sarah pulled up the medication cart. "I'm here. Might as well work." Patricia studied her for a long moment. "You know Marcus hasn't shown his face since yesterday morning?" Sarah started counting out medications. "Not my problem." Administration pulled him into a closed-door meeting, 3 hours. Then he left through the side entrance. "Still not my problem." Patricia sighed. "You're allowed to feel something about this, you know, about him finally getting what he deserves." Sarah's hands paused over a morphine vial. "What he deserves is to learn how to be a better doctor. What happens to him beyond that isn't my concern." "You're more generous than I'd be." "I'm not generous." Sarah logged the medication and moved to the next drawer. "I'm just tired of caring about people who never cared about me." The words came out sharper than she intended. Patricia didn't respond. Sarah finished her count and headed toward the patient rooms, leaving the conversation unfinished behind her. Good. At 11:30, Dr. Raymond Cross found her outside the ICU. Raymond was the hospital's chief medical officer, a tall man in his early 60s with silver hair and the kind of calm authority that came from 30 years of making impossible decisions. Sarah had maybe spoken to him twice, brief conversations about scheduling conflicts and protocol updates. He didn't usually seek out individual nurses. "Lieutenant Bishop," he said. Not a question, a statement. Sarah turned. "Dr. Cross, do you have a minute?" It wasn't really a question either. They walked to a small consultation room off the main corridor. Raymond closed the door and gestured to a chair. Sarah remained standing. "I wanted to speak with you about yesterday," he said. "I followed federal emergency protocols. If there's an issue with—" "There's no issue." Raymond's voice was gentle, too gentle. "I wanted to thank you. What you did for those soldiers, for Sergeant Torres, that was extraordinary." Sarah felt her shoulders tighten. "I did my job." "You did significantly more than that." He pulled out a tablet, tapped the screen a few times. "I've been reviewing your personnel file. Your actual personnel file, not just the civilian nursing credentials." Sarah said nothing. 3 tours in active combat zones. Battlefield commendation for life-saving actions under fire. Bronze Star with Valor. Honorable discharge with full benefits. Raymond looked up. "Why didn't you disclose any of this when you were hired?" "It wasn't relevant." "Wasn't relevant?" Raymond's eyebrows rose. "You have more trauma experience than half our surgical staff combined. Combat medicine is different from civilian medicine. Not that different. Not when it comes to saving lives." Sarah crossed her arms. "Is there something specific you need from me, Dr. Cross?" He set the tablet down. "The Department of Defense contacted me this morning. They want to establish a consulting relationship with Riverside General. Specifically, they want you to develop a combat trauma training protocol for our emergency department staff." The room tilted slightly. "They want what?" "A training program, based on your field experience. Teaching our doctors and nurses how to recognize and treat blast injuries, penetrating trauma, mass casualty scenarios. The kind of injuries we normally never see, until we do." Sarah's mind raced. "I'm a floor nurse. I don't have the authority to—" "You would if you accepted the position I'm offering." Silence filled the space between them. Raymond leaned against the desk. "I'm creating a new role, Emergency Crisis Coordinator. You'd oversee disaster preparedness, mass casualty protocols, and specialized trauma response. It comes with a significant pay increase, administrative authority, and the ability to implement training programs across all departments." Sarah stared at him. "You're offering me a promotion." "I'm offering you the job you should have had from the beginning." Raymond's expression hardened slightly. "I won't lie to you, Lieutenant. Part of this is practical. The DoD contract would bring substantial funding to the hospital, but part of it is corrective. You were underutilized here, undervalued. That was a failure of leadership, and I take responsibility for it. Marcus's leadership, not you. Marcus Hale is currently on administrative leave pending investigation into multiple conduct violations. Raymond's voice didn't change, didn't soften. He won't be returning to his current position. The words landed like stones in water. Sarah felt something shift in her chest. Not triumph, not satisfaction, just the slow, heavy weight of consequences finally arriving. What happens to him? She asked. That depends on what the investigation finds. But his pattern of behavior toward staff, toward you specifically, is well documented. Multiple witnesses have come forward since yesterday. Sarah thought about the break room, the laughter, the casual cruelty. They didn't come forward before. No, Raymond admitted. They didn't. People rarely do until someone else breaks the silence first. Sarah walked to the window. Outside, Langston City sprawled in every direction, lights and darkness, life and emptiness, all of it tangled together. I didn't break the silence, she said quietly. The DoD did. I was just trying to survive. Survival counts. She turned back to face him. I need to think about it. Raymond nodded. Take the time you need. But Sarah, he used her first name. First time ever. You've already proven you can do this job. The question is whether you want to. He left her alone in the consultation room. Sarah stood there for a long time, staring at nothing. At 2 a.m, she went to check on Sergeant Torres. The ICU was dim and quiet, just the soft beep of monitors and the whisper of ventilators. Torres was in bed 7, surrounded by machines that measured every heartbeat, every breath. Sarah pulled up his chart on the computer outside his room. Vitals stable, no fever, urine output adequate. The surgical site showed no signs of infection. He was going to make it. She allowed herself one moment of relief. Then she went back to work. The next 3 days blurred together. Sarah worked her regular shifts, avoided the cafeteria when it was crowded, and deflected questions from curious colleagues with practiced efficiency. The story kept growing, each retelling adding new details, new drama, new elements that hadn't actually happened. By Thursday, people were saying she'd performed the surgery alone. By Friday, the story included her saving a patient's life while under enemy fire in the hospital parking lot. Sarah stopped correcting people, let them have their stories. She just wanted to do her job. Marcus remained absent, officially on leave, unofficially erased, his name removed from the surgical schedule, his office cleared out, his presence scrubbed from the department like a stain. Sarah tried not to think about it, tried not to imagine him sitting in some lawyer's office, crafting defenses for behavior that had no defense. Tried not to wonder if he felt even a fraction of the humiliation he'd inflicted on her. She mostly succeeded. On Saturday morning, Dr. Nina Reeves found Sarah in the medication room. Can I talk to you? Sarah glanced up from the cart she was organizing. About? Nina closed the door, stood there awkwardly, hands shoved in her pockets. I wanted to apologize. For what? For not saying anything. When Marcus was... Nina's voice cracked slightly. When he was treating you like that, I knew it was wrong. We all knew, and nobody said anything. Sarah went back to counting pills. You were a resident. He was your attending. Speaking up would have ended your career. That's not an excuse. No, Sarah agreed, but it's a reason. Nina didn't move, just stood there, radiating guilt. I should have been braver. Sarah sealed a medication packet and logged it in the system. Bravery is easy to demand when you're not the one paying the price. You did what you had to do to survive, same as me. You stood up to him. I corrected a medication error. That's not bravery, that's basic competence. But you didn't back down. Sarah finally looked at her, really looked at her. Nina was 28, maybe 29. Brilliant and ambitious and terrified of making mistakes. Sarah had been exactly the same at that age, before the military, before the combat zones, before she learned that mistakes didn't just cost careers, they cost lives. You want to make it right? Sarah asked. Nina nodded. Be better than him. When you're the one in charge, when you have residents looking up to you, remember what it felt like to watch someone get humiliated and do nothing. Remember that feeling, and don't let it happen again. Nina's eyes were bright. I won't. Good. Sarah finished her count and headed for the door. Lieutenant? She stopped. Are you taking the coordinator position? Sarah didn't answer. She just left. Mount. Sunday afternoon, Sarah visited Sergeant Torres. He'd been moved out of the ICU and into a regular room. Still weak, still recovering, but alive. Conscious. Talking in short, painful bursts. Sarah knocked on the doorframe. Torres looked up. His face was still pale, still drawn, but his eyes were clear. Nurse Bishop, he said, voice rough from the breathing tube. Lieutenant Bishop, she corrected gently. But Sarah works fine. He tried to smile, manage something close. They told me you saved my life. You saved your own life by being strong enough to survive the ride here. I just did the technical part. Torres shifted slightly in the bed, wincing. The DOD guy said you operated on me for almost 4 hours. Found shrapnel nobody else saw. Sarah pulled up a chair. How are you feeling? Like I got hit by a truck carrying explosives? That's fairly accurate. This time his smile was genuine. They sat in silence for a moment, just the sound of the IV pump and distant hospital noise filtering through the door. I heard what happened, Torres said quietly. About the doctor who got suspended. About you being a combat medic. Sarah's jaw tightened. It's not important. Sounds important to me. What's important is your recovery. Everything else is just hospital politics. Torres studied her with the kind of directness that came from staring at death and deciding to live anyway. You know what I remember most from the accident? Sarah waited. Your voice. In the OR. I was mostly out of it, barely conscious, but I heard you. Calm, steady, like you'd done this 1,000 times. He paused. Made me think I might actually make it. Something caught in Sarah's throat. You did make it. Because of you. She stood up, suddenly needing to move. You should rest. I just wanted to check on you. Lieutenant, Sarah. Torres met her eyes. Thank you. She nodded once and left before the gratitude could settle too deep. That evening, Sarah sat in her apartment with Raymond Cross's offer letter on the coffee table in front of her. Emergency Crisis Coordinator, $68,000 a year. Benefits. Authority. Recognition. She'd read it 17 times. Hadn't signed it yet. Her phone buzzed. Another text from an unknown number. This is Colonel Jameson Wright, DOD Medical Division. Heard about your situation at Riverside. If you're interested in coming back to active service, I can make some calls. We need people like you. Sarah stared at the message. Coming back. Like she'd ever really left. Like Lieutenant Bishop had just been waiting under Nurse Bishop's skin, ready to emerge the moment someone called her by rank. She thought about Kandahar, about the surgical tent where she'd worked 18-hour shifts, about the soldiers who'd lived because she'd been fast enough, skilled enough, desperate enough to keep them breathing. She thought about the ones who hadn't. Their faces were still clear, still sharp. She deleted the text without responding. Set the phone down. Picked up the offer letter again. The thing nobody understood about survival was that it never ended. You didn't just survive once and then coast. You survived every single day. You survived the memories and the guilt and the horrible knowledge that you'd been good at keeping people alive in situations where most people died. And sometimes, most times, you survived by being quiet, by being invisible, by letting the world forget what you were capable of. But Riverside General hadn't forgotten. They knew now. All of them. And Sarah had to decide if she wanted to be Lieutenant Bishop again, or if she wanted to go back to being the nurse nobody noticed. Except going back wasn't an option anymore. The door had been kicked open. The silence had been broken. She signed the letter. Monday morning, Sarah reported to Raymond Cross's office to make it official. She expected paperwork, maybe a handshake, quick and professional. Instead, she found Raymond standing with 3 people she didn't recognize, 2 men in suits and a woman in a crisp military uniform with enough decorations to make Sarah's Bronze Star look modest. Lieutenant Bishop, the woman said, I'm Colonel Andrea Matthews. We spoke on the phone during the convoy incident. Sarah shook her hand. Colonel, I wanted to be here personally to discuss the DoD contract with Riverside General. Your new position will be instrumental in implementing our training protocols. One of the men stepped forward. I'm Jeffrey Brennan, Hospital Legal Counsel. We have some liability questions regarding... Already addressed, Colonel Matthews interrupted smoothly. The DoD will provide full indemnification for any training exercises conducted under federal oversight. Riverside General assumes no additional risk. Jeffrey looked like he wanted to argue. Didn't. Raymond gestured to the conference table. Shall we? They sat. Papers were spread out. Terms were discussed. Sarah listened as they talked about her like she was a resource to be allocated, a skill set to be deployed. Lieutenant Bishop will need administrative authority over all emergency protocols, Colonel Matthews said. That includes the ability to override attending physician decisions in crisis scenarios. Jeffrey frowned. That's highly irregular. So is having a combat medical officer on staff, the colonel replied. Irregular is the point. Raymond glanced at Sarah. Are you comfortable with that level of authority? Sarah thought about Marcus Hale, about the medication error, about all the times she'd seen something wrong and stayed quiet because speaking up meant consequences. Yes, she said. I am. The meeting lasted 90 minutes. By the end, Sarah had more authority than she'd ever wanted and less anonymity than she'd ever feared. She walked out of Raymond's office feeling like she'd signed away some fundamental part of herself. But when she passed the trauma bay and saw Patricia coordinating 3 incoming patients with the kind of exhausted competence that kept hospitals running, something settled in her chest. This was the work, the real work, not the politics or the recognition or the revenge, just the work. She could live with that. Marcus Hale returned to Riverside General on Tuesday, not to work, to clean out his office. Sarah didn't see him arrive. She was 3 floors up, running through a disaster preparedness drill with a group of skeptical residents who couldn't understand why they needed to practice mass casualty protocols. Because, Sarah explained for the 3rd time, when it happens for real, you won't have time to think. You'll just react. And if you haven't practiced the right reactions, people die. A resident named Kevin raised his hand. But statistically, statistics don't matter when you're the one standing in a trauma bay with 17 critical patients and 4 available surgeons. What matters is whether you've trained your brain to make the right calls under pressure. Kevin looked unconvinced. Sarah pulled out her phone and showed him a photo she'd kept locked in a private folder for 6 years. It was a surgical tent in Helmand Province. Blood on every surface, wounded soldiers on stretchers, and Sarah in the center of it all, her hands inside someone's chest cavity, her face perfectly calm. This is what I'm trying to prepare you for, she said quietly. Pray you never need it, but be ready in case you do. Kevin stared at the photo. Nobody raised their hand again. Sarah finished the drill and headed back to her office. A small room near the trauma department that still smelled like fresh paint and new furniture. That's when she heard the commotion, raised voices near the elevators, the particular pitch of conflict that made everyone stop and turn. Sarah rounded the corner and found Marcus Hale standing in the hallway with a cardboard box in his hands and rage in his eyes. He was arguing with Raymond Cross. Completely inappropriate. Marcus's voice echoed off the walls. You promoted a nurse over qualified surgeons because of some military theater. I promoted the most qualified person for the position, Raymond said evenly. A decision you forced me to make by creating a hostile work environment. You publicly humiliated a decorated combat officer. You ignored her medical expertise. You created a culture where staff were afraid to speak up. Raymond's calm never cracked. That's not leadership, Dr. Hale. That's liability. Marcus saw Sarah standing there, his face twisted. This is your fault. Sarah didn't respond. You couldn't just be a nurse. You had to make it about your ego, your military background. I didn't tell anyone, Sarah said. Quiet. Factual. Then who did? The Department of Defense. When they needed someone who knew how to save soldiers with blast injuries. She paused. Someone you dismissed as incompetent. Marcus's hands tightened on the box. I made one mistake. You made dozens. Raymond stepped between them. We have documented complaints from 17 different staff members. This wasn't one mistake, Marcus. This was a pattern. Because of her. Because of you. The words hung in the corridor like smoke. Marcus looked at Sarah. Really looked at her. And for the first time, she saw something other than arrogance in his face. She saw fear. The same fear she'd seen in soldiers when they realized they'd been wrong about something fundamental. When they understood that their assumptions had nearly killed them. "I'm a good surgeon," Marcus said. Quieter now. Almost pleading. "You were a good surgeon with terrible judgment about people," Raymond corrected. "And in this hospital, that's not enough." Marcus's shoulders sagged. He looked at the box in his hands. At the office he'd never enter again. At the career he'd spent 15 years building and destroyed in less than 15 minutes of cruelty. "Where am I supposed to go?" he asked. Not to Raymond, not to Sarah, just to the universe. Nobody answered. He walked toward the elevator, his footsteps echoing in the silence. Sarah watched him go. Felt nothing, no triumph, no satisfaction, just the hollow ache of watching someone fall and knowing she couldn't have stopped it even if she'd wanted to. Raymond touched her shoulder gently. "You okay?" Sarah nodded. She wasn't sure if it was true, but it was the only answer she had. That night, Sarah received an email from Colonel Matthews. Subject line, "Request for consultation." The message was brief. "Lieutenant Bishop, we have a situation developing at Fort McCready. Multiple casualties from a training exercise gone wrong. Similar injuries to the convoy incident. We could use your expertise. This would be voluntary, compensated. 24 hours on site. Let me know." Sarah stared at the email. Fort McCready was 6 hours away. She had 3 shifts scheduled this week. She could say no. She should say no. Her fingers hovered over the keyboard. Then she thought about Sergeant Torres, about the soldiers she'd saved, about the ones she hadn't, about the fact that Lieutenant Bishop had never been very good at saying no when lives were on the line. She typed 3 words. "I'll be there." Hit send, and wondered if she'd just made the biggest mistake of her new life, or if she'd finally stopped running from who she'd always been. Outside her window, Langston City glittered in the dark. 1,000 lights, 1,000 lives, all of them fragile and temporary and worth saving. Sarah Bishop closed her laptop, packed a bag, and prepared to remember things she'd spent years trying to forget. Fort McCready sat in the middle of nowhere, Kansas, like a scar on the prairie. Chain-link fences, concrete bunkers, and training grounds that stretched to the horizon. Sarah arrived at dawn, her rental car kicking up dust on the access road as security checkpoints materialized out of the flat landscape. The guard at the gate checked her credentials twice. "Lieutenant Bishop?" "That's right." He made a phone call, waited, then waved her through. "Medical building is straight ahead. Colonel Matthews is waiting." Sarah drove past rows of identical barracks, past obstacle courses and firing ranges, past young soldiers running in formation while sergeants screamed motivation into the morning air. It looked exactly like every base she'd ever served on. The same exhausted determination, the same careful balance between discipline and chaos. She told herself she was done with this world. Apparently the world disagreed. Colonel Matthews met her in the parking lot outside a low brick building marked Medical Services. The colonel looked like she hadn't slept in 2 days, uniform crisp but eyes tired, the kind of exhaustion that came from making life or death decisions on insufficient information. "Lieutenant, thank you for coming." Sarah grabbed her bag from the back seat. "What's the situation?" "Live fire training exercise yesterday afternoon. Simulated IED scenario. Something went wrong with the charge placement. Explosion was twice the expected yield." Matthews started walking toward the building. Sarah fell in step beside her. "We have 4 casualties, 3 stable, 1 critical. The critical case is a 22-year-old specialist named Tyler Gaines. Penetrating abdominal trauma, suspected liver laceration, possible bowel perforation. Why not airlift him to a civilian trauma center?" Matthews's jaw tightened. Because the exercise was classified. New counterinsurgency protocols were testing. If word gets out that we had casualties during the first trial run, she didn't finish the sentence, didn't need to. Sarah understood immediately. Politics and optics mattered more than optimal medical care. Same story, different war. "Where is he now?" Surgical suite. Our trauma team has been working on him since last night. They're good, but Matthews hesitated. They're not you. They entered the medical building through a side door. The interior was exactly what Sarah expected. Sterile corridors, flickering fluorescent lights, the smell of disinfectant barely masking old blood. A handful of medics moved through the hallways with the purposeful efficiency of people who'd been running on adrenaline for too long. Matthews led her to a scrub room outside the main surgical theater. Through the observation window, Sarah could see the OR. Specialist Gaines was on the table, surrounded by monitors and machines. A surgeon Sarah didn't recognize was elbow deep in the abdominal cavity, working with the kind of desperate concentration that meant things weren't going well. "That's Major Kenneth Rourke," Matthews said. 20 years experience, multiple deployments, best trauma surgeon we have on base. Sarah watched Rourke's hands, watched the way he moved, confident but tense, skilled but struggling. "He's missing something," she said quietly. Matthews looked at her. "What?" "I don't know yet, but his body language says he can't find the source of the bleeding." As if on cue, an alarm started beeping in the OR, blood pressure dropping. Rourke's voice came through the intercom, sharp with controlled panic. "I need more suction, and someone get me another 4 units typed and crossed." A nurse scrambled to comply. Sarah's hands were already moving, scrubbing in before she'd consciously made the decision. Matthews didn't stop her. "You're cleared to assist. Full authority." Sarah nodded once and pushed through the OR doors. The heat hit her first, surgical lights blazing, everyone sweating under gowns and masks. Then the smell. Blood and bowel content and the sharp chemical tang of cauterized tissue. Rourke looked up as she approached the table. "Who the hell are you?" "Lieutenant Sarah Bishop, Combat Medical Officer. Colonel Matthews brought me in to consult." Rourke's eyes narrowed above his mask. "I don't need a consultant. I need this kid to stop bleeding." Sarah moved to the opposite side of the table and looked into the open abdomen. Blood everywhere, dark and arterial, pooling faster than suction could clear it. Her mind clicked into combat mode. Liver laceration on the right lobe, grade 3, maybe 4, packed but still oozing. Bowel intact. Spleen looked okay, but the bleeding wasn't coming from the liver. It was coming from somewhere else. "Retract the small bowel," she said. Rourke didn't move. "I already checked." "Retract it." Something in her voice made him comply. Sarah peered into the deep retroperitoneal space, past the organs, down to the structures most surgeons forgot about until it was too late. And there it was. "Right renal artery," she said. "Partial tear. You're not seeing it because the kidney's blocking the view and the bleeding's tracking behind the bowel mesentery." Rourke stared. "That's impossible. The blast pattern. Blast wave doesn't follow predictable paths. It finds weak points." Sarah held out her hand. "I need a vascular clamp and 40-proline. The scrub nurse looked at Rourke. He hesitated. In that moment, Sarah saw exactly what she'd seen at Riverside General, ego colliding with competence, pride wrestling with the horrible knowledge that someone else might be right. "Sir," the anesthesiologist said quietly, "pressure's down to 80/40. That broke the spell. Rourke nodded to the nurse. Sarah took the clamp and went to work. The renal artery was buried deep, tucked behind tissue and blood. She worked by feel as much as sight, isolating the vessel, controlling the bleeding, exposing the tear. Clamp. The flow stopped. Not completely, never completely, but enough. Suture. Her hands moved on autopilot. Thousands of hours of practice compressed into muscle memory so deep it felt like instinct. She'd done this exact repair in a field hospital outside Kabul, then again in Kandahar, then twice more in places she'd tried to forget. The difference was that those soldiers had been covered in dust and screaming and dying under mortar fire. This was quiet, sterile, professional. Somehow that made it worse. "Pressure's coming back up," the anesthesiologist said. 90/50, still climbing. Sarah finished the repair and stepped back. The bleeding had stopped. Rourke was staring at her like she'd just performed magic instead of basic vascular surgery. "How did you—" "I've seen it before." Sarah stripped off her gloves. "You'll want to monitor for compartment syndrome over the next 24 hours. The blast wave can cause delayed tissue swelling even after you've controlled the immediate trauma." I know how to manage post-op. I'm sure you do. Sarah headed for the door. But I've seen soldiers die 3 days after we saved them because nobody was watching for the delayed complications. Don't let that happen here. She left before he could respond. Matthews was waiting in the hallway. That was fast. It wasn't that complicated, just easy to miss. Sarah pulled off her surgical cap. Her hair was plastered to her skull with sweat. Gaines should be fine if they watch him closely. Will they? Sarah glanced back at the OR. Through the window, she could see Rourke already closing, his movements mechanical and precise. Yeah, she said. Rourke's a good surgeon. He just got tunnel vision. Happens to everyone eventually. Matthews studied her. You don't sound angry about it. Why would I be angry? Because he questioned you. Hesitated when you needed immediate action. Sarah shrugged. He didn't know me. I walked into his OR and told him he was missing something. Most surgeons would have reacted the same way. But you didn't wait for permission. Permission takes time. Gaines didn't have time. They walked outside into air that already felt thick with Kansas summer heat. The sun was climbing fast, turning the prairie into something that shimmered and wavered at the edges. Matthews stopped by Sarah's rental car. The DOD wants to formalize our arrangement with you. Sarah had been expecting this, dreading it. What kind of arrangement? Contract position. On-call consultant for military medical emergencies. You'd maintain your civilian job at Riverside, but when we need expertise in combat trauma, you'd be available. Compensated at GS-13 scale, full travel expenses, benefits. How often? Hard to say. Could be once a month, could be once a year. Matthews pulled out a folder from her briefcase. Could be never. But when it happens, we need to know we can reach someone who understands this world. Sarah took the folder without opening it. I'll think about it. That's all I'm asking. Matthews paused. For what it's worth, Lieutenant, you saved that kid's life. Rourke's good, but he wouldn't have found that renal artery in time. Gaines would have bled out. Sarah looked across the base. Soldiers everywhere, young faces, old determination. He's not the first, she said quietly. No, and he won't be the last. Matthews extended her hand. Thank you for coming. Sarah shook it, drove away without looking back. What? She was halfway to the highway when her phone rang. Raymond Cross. Sarah answered on speaker. Dr. Cross? Sarah, where are you? Kansas, military consultation. I'll be back tomorrow afternoon. We have a problem. Sarah's hands tightened on the wheel. What kind of problem? Marcus Hale filed a formal complaint with the state medical board. He's claiming wrongful termination, hostile work environment, and Raymond's voice hardened. He's claiming you falsified your credentials. The car swerved slightly. Sarah corrected. That's insane. He's arguing that you performed surgery at Riverside without proper civilian credentials, that you operated outside your scope of practice as a registered nurse. I was operating under federal emergency authority, the DOD liaison. I know, and we have documentation. But Hale's lawyers are arguing that the emergency authority only covered the initial trauma stabilization, not the definitive surgical repair. They're saying you exceeded your authorization. Sarah's jaw clenched so hard it hurt. So what happens now? The medical board is opening an investigation. They want to interview you, review the surgical records, examine your military credentials. Raymond sighed. This could take months, Sarah. And in the meantime, I'm under investigation. Yes. Sarah drove in silence for a long moment, watching the Kansas prairie blur past. Does this affect my position at Riverside? No. You're on administrative leave pending the investigation, but your position is secure. The DOD contract protects you legally, and frankly, the hospital has too much invested in this program to let one vindictive surgeon derail it. But my reputation, your reputation, is the only reason we're having this conversation. If you were anyone else, Hale wouldn't bother. He's doing this because you humiliated him. I didn't humiliate him. I just did my job. And that was enough. Sarah ended the call. Drove another 20 miles in numb silence. Then she pulled over at a rest stop, walked to a picnic table under a dying tree, and sat down. Her hands were shaking, not from fear, not from anger, from the horrible realization that it didn't matter how good she was, didn't matter how many lives she saved, didn't matter that she'd spent 3 tours keeping soldiers alive in impossible conditions. Marcus Hale had power, connections, lawyers, and he was willing to burn everything down rather than admit he'd been wrong. Sarah pulled out her phone and stared at Colonel Matthews' contract offer. 1 call. That's all it would take. She could go back to the military, leave civilian medicine behind, let Riverside General and Marcus Hale and the whole broken system eat itself while she went somewhere her skills were actually valued. Her finger hovered over the number. Then she thought about Patricia, about Nina, about all the nurses and residents who'd watched her stand up to Marcus and started believing that maybe they could too. She thought about Sergeant Torres, alive because she'd recognized an injury pattern nobody else would have seen. She thought about the next patient who'd need someone with combat trauma experience, and the one after that. Sarah put the phone away. She wasn't running. Not this time. She drove straight through the night and arrived back in Langston City as the sun was rising. Her apartment felt foreign, too quiet, too empty, like a stage set she'd walked away from too long. She showered, changed, tried to sleep. Couldn't. At 8 a.m., her phone rang again. Unknown number. She almost didn't answer. Bishop. Lieutenant Bishop, this is Captain Aaron Voss. I'm a JAG attorney assigned to the Department of Defense Medical Division. Sarah sat up. Okay. Colonel Matthews informed me about the complaint filed against you by Dr. Marcus Hale. I wanted to reach out personally to let you know that the DoD will be providing full legal support for your defense. Why? A pause. I'm sorry? Why is the DoD getting involved in a state medical board investigation? Voss's voice shifted slightly, more formal now. Because your actions at Riverside General were conducted under Federal Emergency Medical Authority as outlined in Title 10, Section 1094 of the U.S. Code. Any attempt to penalize you for those actions represents a direct challenge to federal jurisdiction over military medical personnel. Sarah processed that. You're saying this isn't just about me. This is about establishing precedent. If a state medical board can second-guess federal emergency protocols, it undermines our ability to utilize combat medical officers in civilian crisis situations. Voss paused. But yes, Lieutenant, it's also about you. What you did saved lives. We're not going to let someone destroy your career because their ego got bruised. Sarah felt something loosen in her chest. Not relief exactly. Just the realization that she wasn't fighting alone anymore. What do you need from me? Right now, nothing. We're filing a motion to dismiss based on federal preemption. But if it goes to a hearing, we'll need you to testify. I can do that. Good. Voss's tone warmed slightly. For what it's worth, Lieutenant, I reviewed your service record, your commendations, the lives you saved. This complaint is bullshit, and we're going to prove it. Thank you, Captain. Just doing my job, same as you. The call ended. Sarah sat on her couch, staring at the wall. Her life had become a strange battleground, not the kind with bullets and explosions, but one fought in conference rooms and legal filings and bureaucratic procedures. She hated it, but she'd survived worse. Okay. The next 3 weeks were a blur of depositions and documentation. Sarah met with JAG attorneys who picked apart every second of the military convoy response. She submitted her service record, her medical credentials, her training certifications. She wrote detailed reports explaining exactly why she'd made each surgical decision and how those decisions had aligned with combat trauma protocols. Marcus's lawyers pushed back hard. They argued that federal emergency authority didn't extend to definitive surgical interventions, that Sarah had exceeded her scope of practice, that she'd endangered patient safety by performing procedures she wasn't credentialed for in a civilian setting. The medical board scheduled a hearing. Sarah spent her administrative leave preparing testimony and trying not to think about the fact that her entire career now depended on convincing a panel of bureaucrats that she'd been right to save a soldier's life. The absurdity of it would have been funny if it wasn't so terrifying. On a Tuesday morning, Nina Reeves showed up at Sarah's apartment with coffee and determination. "You look like hell," Nina said. "Thanks. I'm serious. When's the last time you slept?" Sarah took the coffee. "I sleep. Nightmares don't count. They sat in Sarah's living room while rain hammered against the windows. Langston City in October was all gray skies and wet pavement, the kind of weather that made everything feel heavier. "I testified yesterday," Nina said quietly. Sarah looked up. "For the board?" "Yeah, they're interviewing everyone who was in the trauma bay during the convoy incident." Nina wrapped her hands around her own coffee cup. "I told them you saved those soldiers, that nobody else in that building could have done what you did." "Did they listen?" "I don't know. The lawyers kept trying to make it about protocols and credentials." Nina's jaw tightened. Like any of that matters when someone's bleeding out. Sarah stared into her coffee. "It matters to them. That's the problem." "Then they're idiots." Despite everything, Sarah almost smiled. "You should be careful. Speaking up for me could hurt your career." Nina met her eyes. "You think I don't know that? You think I haven't thought about it?" She set down her cup. "But I watched you stand up to Marcus when nobody else would. I watched you save lives while he was having a tantrum about his ego. And I decided that if this is the kind of career where doing the right thing gets you punished, maybe it's not worth having." Sarah felt something crack in her chest. "You don't mean that." "I absolutely mean that." Nina stood up. "The hearing is next week, right?" "Thursday. Then I'll see you there." "And Sarah?" She paused at the door. "You're going to win this. Because you're right. And eventually, even bureaucrats have to admit when someone's right." She left before Sarah could argue. Sarah sat alone in her apartment, listening to the rain, and wondered if Nina's optimism was courage or just naivety. The hearing was held in a conference room at the State Medical Board headquarters, a building that looked like every other government office Sarah had ever been in. Beige walls, fluorescent lights, the smell of old coffee and stale anxiety. Sarah arrived with Captain Voss and 2 other JAG attorneys. They'd prepped her for 3 days straight, reviewed every question they might ask, practiced her testimony until the words felt mechanical in her mouth. Marcus was already there. He sat on the opposite side of the room with his lawyers, 3 of them, all in expensive suits, all radiating the kind of confidence that came from billable hours and corporate retainers. He didn't look at Sarah. She didn't look at him. The board consisted of 5 members, 3 physicians, 1 nurse administrator, and 1 public representative. They sat behind a long table like judges at a tribunal, their faces carefully neutral. The chairperson, a gray-haired surgeon named Dr. Ellen Casper, called the hearing to order. "We're here to review a complaint filed by Dr. Marcus Hale regarding the conduct of Lieutenant Sarah Bishop during a medical emergency at Riverside General Hospital on," she consulted her notes, "September 14th of this year." Sarah's lawyer stood. "For the record, Captain Aaron Voss representing Lieutenant Bishop on behalf of the United States Department of Defense." One of Marcus's lawyers rose. "Gerald Hoffman representing Dr. Hale." Dr. Casper nodded. "Mr. Hoffman, you may present your case." What followed was 2 hours of legal arguments that had nothing to do with medicine and everything to do with jurisdiction and credentials and technicalities Sarah barely understood. Hoffman argued that Sarah had operated outside her scope. Voss countered with federal statutes and emergency protocols. Hoffman presented expert testimony from a civilian surgeon who'd never served in combat. Voss presented Sarah's service record and commendations from 3 different commanding officers. Back and forth, argument and counterargument. Sarah sat through all of it, her hands folded in her lap, her face carefully blank. Then Dr. Casper turned to her. "Lieutenant Bishop, we'd like to hear from you directly. In your own words, can you explain the decisions you made that night?" Sarah stood, walked to the small podium they'd set up, looked at the 5 faces staring back at her. "Sergeant Michael Torres was going to die," she said. "Not because anyone at Riverside was incompetent, but because the injuries he sustained required experience that most civilian surgeons don't have. I have that experience. So when the Department of Defense requested my assistance under federal emergency authority, I provided it." "But you're not a licensed surgeon," one of the board members said. "You're a registered nurse. I'm a combat medical officer. I've performed damage control surgery in field hospitals, under conditions you can't imagine. I've saved lives in situations where the nearest trauma center was 200 miles away, and the only tools I had were what I could carry in a backpack." Sarah kept her voice level, factual. "That night, I had better tools, better support, and a patient who needed exactly the skills I'd spent 3 tours developing. Hoffman stood up. With all due respect, Lieutenant Bishop's military service is commendable, but it doesn't change the fact that she performed surgical procedures she wasn't credentialed for in a civilian setting. She was credentialed, Voss interrupted, by the United States military, which has jurisdiction over military casualties in emergency situations. Not when those situations occur in civilian hospitals. Dr. Casper held up a hand. Gentlemen, this isn't helping. With respect, Dr. Casper, rules matter, protocols matter, but they matter because they keep patients safe. And when following the rules means a patient dies, the rules are wrong. She paused. I didn't break any laws that night. I followed federal emergency protocols exactly as they're written. But even if I had broken a law, even if I'd crossed every line you're worried about, I'd still make the same choice because I became a medic to save lives. And I'm not going to apologize for being good at it. Silence filled the conference room. Then one of the board members, the nurse administrator, a woman named Margaret Torres, spoke up. I have a question for Dr. Hale. Everyone turned. Marcus straightened in his seat. Yes? You were present during this emergency. You were the chief of trauma surgery. Why didn't you perform the surgery yourself? Marcus's face went red. I was coordinating the overall response. But you were in the OR. You watched Lieutenant Bishop operate. Is that correct? Yes, but... And did you at any point tell her to stop? Did you assert your authority as the ranking surgeon and take over the procedure? Marcus's mouth opened, closed. No, he finally said. Why not? Because... He stopped, started again. Because I was observing to ensure patient safety. Or because you knew she was better equipped to handle it than you were. The words landed like a bomb. Marcus stared at Margaret Torres with something close to hatred. I don't have to answer. Actually, Dr. Hale, you do. Dr. Casper leaned forward. You brought this complaint. You put Lieutenant Bishop's career on trial. So yes, you have to answer. Did you believe she was endangering the patient? A long pause. No, Marcus said quietly. Then why file the complaint? Another pause, longer this time. Because she humiliated me. The room went absolutely silent. Marcus seemed to realize what he'd just said. His face went white. I mean, that's not... I filed the complaint because of legitimate concerns about... But it was too late. The truth was out. Dr. Casper looked at him with something that might have been pity or might have been disgust. This hearing is adjourned. The board will deliberate and issue a decision within 30 days. She banged the gavel. It was over. What? Sarah walked out of the building into October sunshine that felt wrong after the fluorescent prison of the conference room. Captain Voss was grinning like he'd just won the lottery. Did you see his face? My God, that was beautiful. Sarah didn't feel beautiful. She felt exhausted. It's not over yet. It's over, trust me. When a complainant admits on the record that he filed because his feelings were hurt, the board has no choice but to dismiss. Voss clapped her on the shoulder. You won, Lieutenant. I won't believe it until I see the decision. Then you're going to believe it in 30 days, maybe sooner. Sarah wanted to share his confidence. Couldn't quite get there. She drove back to Langston City alone, watching the highway signs blur past, thinking about everything that had led to this moment. The humiliation, the emergency, the surgery, the aftermath. All of it, because she'd corrected a medication error and saved a soldier's life. Her phone rang as she pulled into her apartment complex. Colonel Matthews. I heard about the hearing. Voss says it went well. We'll see. I also heard Marcus Hale admitted he filed out of spite. Matthews' voice was careful. That's good for you. It's pathetic for him. Yes, it is. A pause. Sarah, I know you're waiting on the board's decision, but I wanted to extend the DoD contract offer again. Regardless of how this shakes out, we want you on our team. Sarah parked the car, turned off the engine. I still haven't decided. I know, but the offer stands. Think about it. The call ended. Sarah sat in her car, staring at the building where she lived, and felt the weight of every decision pressing down on her shoulders. She'd stood up to Marcus Hale, saved 5 soldiers, testified under oath, And now she was waiting for 5 strangers to decide whether she'd broken rules that shouldn't have mattered in the first place. It wasn't justice. It was bureaucracy. But sometimes bureaucracy was the best you could hope for. She went inside, made dinner she didn't eat, and waited for a decision that would determine whether the last 6 weeks had meant anything at all. 18 days later, the medical board issued their ruling. The complaint was dismissed with prejudice. Sarah received the email at 3 in the morning, couldn't sleep, was staring at her laptop, refreshing her inbox compulsively. The decision was 30 pages long. She read every word. The board found that Sarah had acted within the scope of Federal Emergency Medical Authority, that her credentials were valid, that her decisions had been medically sound and had resulted in positive patient outcomes. They also included a formal censure of Marcus Hale for filing a frivolous complaint motivated by personal animus rather than legitimate professional concerns. Sarah read the last paragraph 3 times. Lieutenant Bishop's actions represent the highest standards of medical practice under crisis conditions. Her willingness to utilize specialized combat trauma expertise in a civilian emergency setting resulted in the preservation of multiple lives and should be commended, not condemned. She closed her laptop, sat in the dark, and finally, let herself feel something other than fear, not triumph, not vindication, just the quiet certainty that she'd been right all along, and that sometimes, eventually, the truth actually mattered. Her phone buzzed. A text from Nina. "You won. Won." Then Patricia. "Heard the news. We're celebrating tomorrow night. No excuses." Then Raymond Cross. "Welcome back, Lieutenant. Your office is waiting." Sarah smiled, actually smiled. Then her phone rang with a number she didn't recognize. She answered without thinking. "Bishop." Heavy breathing, familiar, wrong. Then Marcus Hale's voice, slurred and desperate. "You destroyed me." Sarah's blood went cold. "Marcus, I lost everything. My job, my reputation. My wife filed for divorce. All because you couldn't just stay quiet." His words were thick, drunk or worse. "All because you had to be a hero." "Where are you?" "Somewhere you'll never find me." The line went dead. Sarah stared at her phone, her heart hammering. Then she called 911. The 911 dispatcher's voice was maddeningly calm. "What's your emergency?" "I just received a call from someone who may be in crisis, Marcus Hale. I think he might hurt himself." "Do you know his current location?" "No." The call just disconnected. "Can you describe the nature of the threat?" Sarah's hand tightened around the phone. "He sounded drunk, unstable. He said I destroyed him, and then the line went dead." A pause. Keys clicking. "Ma'am, we'll send a welfare check to his last known address. Can you provide any additional information about, Sarah hung up. She knew the dispatcher would follow protocol. Send officers to Marcus's house, file a report, check boxes. It wouldn't be enough. She grabbed her keys and was halfway to the door when her phone rang again. Patricia. "Sarah, I just got a call from Jennifer Hale, Marcus's wife. She's frantic. Says Marcus showed up at her sister's house where she's been staying, completely incoherent, saying terrible things. She called the police, but he left before they arrived." "Did she say where he went?" "Riverside General. He kept saying he needed to fix what was broken at the hospital." Sarah's blood turned to ice. "I'm on my way." She was in her car before Patricia could respond. The drive to Riverside took 12 minutes that felt like 12 hours. Sarah's mind raced through possibilities. Marcus drunk and angry. Marcus armed. Marcus confronting staff who testified against him. Every scenario ended badly. She called hospital security from the parking garage. "This is Lieutenant Bishop. We have a potential situation. Dr. Marcus Hale may be on premises and possibly unstable. I need you to—" "We're aware, Lieutenant." The security supervisor's voice was tight. "He's in the trauma department right now. We have officers responding, but he's barricaded himself in his old office." "Is anyone hurt?" "Not yet, but he's demanding to speak with you." Sarah's foot hit the accelerator. The parking garage was chaos. Police cruisers with lights flashing, hospital security vehicles, and a cluster of staff members huddled near the entrance. Sarah recognized Nina among them, her face pale in the emergency lighting. "He's been in there for 20 minutes, Nina said. "Won't talk to anyone except you." A police officer stepped forward. "Lieutenant Bishop, I'm Sergeant Cole Brennan. We need to assess the situation before anyone else goes in." "What's he saying?" "Not much that makes sense. Something about his career being stolen, about you ruining his life. Brennan's expression was grim. We don't know if he's armed. Sarah looked toward the trauma department entrance. Through the glass doors, she could see the hallway. Empty, quiet, wrong. Let me talk to him. Ma'am, I can't authorize that until we know. He called me. He asked for me. And every minute we waste is another minute he gets more unstable. Sarah met Brennan's eyes. I've talked down soldiers in combat zones who were ready to eat their guns. I can handle this. Brennan studied her for a long moment. Then he pulled out a radio and spoke to someone Sarah couldn't see. We're clearing a path. You go in, you stay in visual contact with our officers. You see a weapon, you get out immediately. Understood? Understood. Sarah walked through the doors into a hospital that felt like a crime scene waiting to happen. The trauma department was deserted, patients evacuated, staff relocated, just empty corridors and flickering fluorescent lights. Sarah's footsteps echoed as she approached Marcus's old office. The door was closed. She could hear movement inside, something breaking. Marcus? She kept her voice level, calm. It's Sarah. You wanted to talk? Silence. Then the door opened 6 inches. Marcus stood in the gap. He looked like hell, unshaven, red-eyed, wearing the same clothes she'd seen him in at the hearing. His hands were shaking. You came. You asked. He laughed, bitter and broken. I didn't think you would. Thought you'd be too busy celebrating. I'm not celebrating. Liar. He opened the door wider. His office was destroyed. Furniture overturned, papers scattered, framed diplomas smashed on the floor. Everyone's celebrating, the great Marcus Hale brought down by a nurse who couldn't stay in her lane. Sarah didn't take the bait. Can I come in? Marcus stepped back. Sarah entered slowly, hands visible, posture non-threatening. Behind her, she could feel the police presence, officers positioned in the hallway, ready to respond. You want to know something funny? Marcus was pacing now, manic energy barely contained. I was good, really good. Saved hundreds of lives. Built this department from nothing, and all anyone will remember is that I got destroyed by someone who wasn't even a real doctor. I never said I was a doctor. You didn't have to. You just swooped in with your combat experience and your federal authority and made me look incompetent in front of my own staff. He kicked an overturned chair. Do you have any idea what that feels like? To watch someone do your job better than you ever could? Sarah's voice stayed quiet. Yes, I do. Marcus stopped pacing. What? I know what it feels like to watch someone with more credentials, more respect, more authority make decisions that should have been mine. I lived it every day working under you. That's not the same. It's exactly the same. You dismissed me because I didn't fit your idea of what expertise looks like, because I was quiet and had a state college degree and didn't demand attention. Sarah took a step closer. But the difference between us, Marcus, is that I never tried to destroy you for it. I just did my job. Marcus's face twisted. Your job? You humiliated me. I saved lives. If that humiliated you, that's your problem, not mine. He lunged forward. Sarah didn't flinch. They stood 6 feet apart. His hands were clenched into fists. Hers were steady at her sides. I could have been great, he said, voice cracking. If you hadn't, you were great. And then you let your ego turn you into something else. My ego? Marcus's laugh was sharp, desperate. You stand there lecturing me about ego when you're the one who… But when I what? Corrected your medication error? Saved a patient you would have lost? Used skills I earned through 3 combat tours to help soldiers you couldn't? Sarah's voice cut like a scalpel. Which part of that was ego, Marcus? The part where I was right, or the part where you couldn't handle being wrong? The words hung in the destroyed office. Marcus swayed slightly. For a moment, Sarah thought he might collapse. Then he sank into the only chair still upright. I lost everything. You lost things that shouldn't have mattered more than doing good work. My wife is leaving me. My career is over. The medical board censured me publicly. He looked up at her with eyes that were hollow and lost. What am I supposed to do now? Sarah pulled over a piece of debris and sat across from him. You start over. You get help. You figure out who you want to be when nobody's watching except you. That's easy for you to say. You won. I didn't win anything. I just survived. That's all winning is. Sarah couldn't argue with that. Sergeant Brennan appeared in the doorway. Dr. Hale, we need you to come with us. Get you checked out. Make sure you're safe. Marcus didn't resist, just stood up like a puppet with cut strings and let the officers guide him out. He paused at the door. I'm sorry, he said, not looking at Sarah. For what I did, for what I said, for all of it. Sarah nodded once. I know. They led him away. The aftermath took hours to process. Police reports, witness statements, hospital security protocols. Sarah gave her account 3 separate times to 3 separate people, each time feeling more exhausted than the last. By the time she walked out of Riverside General, dawn was breaking over Langston City. Nina caught up with her in the parking lot. Is he going to be okay? I don't know, Sarah said honestly. Depends on whether he actually gets help or just pretends to until people stop watching. Do you think he meant the apology? Sarah thought about Marcus's face, the defeat, the genuine horror at what he'd become. Yeah, I think he did. Whether that changes anything remains to be seen. Nina fell into step beside her. The whole hospital is talking about what you did, going in there alone, talking him down. I wasn't alone. There were a dozen officers right outside. Still, Nina smiled slightly. Pretty badass. Sarah was too tired to argue. They reached her car. Nina lingered. So what happens now? Now I go home, sleep for about 12 hours, try to remember what normal feels like. I meant with your job, the DoD contract, all of it. Sarah leaned against her car. Honestly, I have no idea. But the hospital had ideas. 3 days later, Raymond Cross called an all-staff meeting in the main conference center. Sarah arrived to find the room packed. Nurses, doctors, residents, administrators, everyone crammed into a space designed for half that many people. Raymond stood at the podium, waiting for quiet. I want to address the events of the past several weeks directly and transparently, he began. Dr. Marcus Hale is no longer employed by Riverside General. He is currently receiving treatment for substance abuse and mental health issues. We wish him well in his recovery, but he will not be returning to this institution. Murmurs rippled through the crowd. I also want to address the elephant in the room, the investigation, the hearing, and the events of Sunday night. Raymond's gaze found Sarah in the crowd. Lieutenant Sarah Bishop acted with extraordinary courage and professionalism throughout this entire ordeal. She was wrongfully accused, publicly investigated, and ultimately vindicated. And then, when her accuser showed up here in crisis, she risked her own safety to de-escalate the situation and ensure no one was harmed. Scattered applause. Sarah felt her face heat. But beyond the drama, beyond the complaints and the hearings and the headlines, what matters is this. Lieutenant Bishop is exactly the kind of medical professional we need at Riverside General. Someone who puts patient care above ego. Someone who uses expertise to save lives rather than build reputation. Someone who understands that medicine is about service, not status. Raymond pulled out a folder. Effective immediately, Lieutenant Bishop is being promoted to Director of Emergency Crisis Response. She will oversee all disaster preparedness protocols, mass casualty training, and specialized trauma response programs. She will have full administrative authority to implement the changes necessary to ensure Riverside General is prepared for any emergency that comes through our doors. The applause was louder this time. Sarah stood frozen while people around her smiled and nodded. Raymond wasn't finished. Additionally, I'm announcing the creation of the Riverside Combat Trauma Initiative, a partnership with the Department of Defense to provide specialized training for civilian medical staff in treating blast injuries, penetrating trauma, and other combat-related casualties. This program will be led by Lieutenant Bishop and will position Riverside as a national leader in emergency trauma care. The room erupted. Sarah felt Patricia grab her arm. Did you know about this? No? Well, congratulations. You just became the most important person in this hospital. Sarah wasn't sure if that was true. But when the meeting ended and people lined up to shake her hand, to congratulate her, to thank her, she started to believe that maybe, possibly, something had actually changed. The official ceremony happened 2 weeks later. Sarah stood in the same conference room wearing her military dress uniform, something she hadn't touched in 4 years. The brass buttons felt foreign. The ribbons and medals on her chest told a story most people in the room had never heard. Colonel Matthews was there, representing the DOD. Raymond Cross was there, representing Riverside. And Sergeant Michael Torres was there, walking with a cane but walking, his eyes bright and clear. "Lieutenant Bishop," Colonel Matthews began, "on behalf of the Department of Defense, I'm pleased to present you with the Meritorious Service Medal for Exceptional Achievement in the performance of meritorious service from September 14th to November 2nd. Your actions during the military convoy emergency and subsequent crisis intervention saved multiple lives and demonstrated the highest standards of military medical practice." She pinned the medal to Sarah's uniform. The room applauded, then Torres stepped forward. "I asked if I could say something," he said, voice still a little rough but strong. "Because Lieutenant Bishop saved my life. Not just in the OR, but by being the kind of person who shows up when things get hard, who doesn't quit when people doubt her, who uses her skills to help instead of hurt." He extended his hand. Sarah shook it. "Thank you," Torres said simply. "For everything." Sarah's throat tightened. "Just doing my job, Sergeant. Best job I've ever seen." That night, Sarah sat alone in her new office at Riverside General, Director of Emergency Crisis Response. The title still felt surreal. The office was bigger than her old break room station. Windows overlooking Langston City, a desk that didn't wobble, framed commendations on the wall. She'd made it, sort of. Her phone buzzed, a text from an unknown number. "Lieutenant Bishop, this is Marcus Hale. I'm in a treatment facility in Colorado. 30 days sober. My therapist says I should make amends to people I've harmed. You're at the top of the list." Sarah stared at the message. "I don't expect forgiveness. I don't deserve it. But I want you to know that watching you work, really work, without ego or agenda, taught me something I should have learned years ago. Medicine isn't about being the smartest person in the room. It's about being useful to the people who need you. I'm sorry for what I did. I'm sorry for who I was. And I'm grateful you stopped me before I did something I couldn't come back from. I hope you're well. I hope Riverside treats you the way you deserve." Marcus Sarah read it twice. Then she typed a response. "I hope your recovery goes well. Take care of yourself." She hit send, deleted the conversation, and turned her attention to the stack of protocols on her desk. The Combat Trauma Initiative needed a curriculum. Disaster, preparedness drills needed scheduling. The next emergency was coming, whether they were ready or not. Sarah Bishop, lieutenant, nurse, survivor, director, pulled up a blank document and started writing. Because this was the work. Not the medals or the recognition or the revenge, just the endless, unglamorous, life-saving work of being ready when crisis arrived. And she was very good at being ready. Mom. 2 months later, on a frozen January morning, Sarah received an email from the state medical board. Subject: Final disposition. Complaint number 2024-7739. She almost deleted it without reading, but curiosity won. Dear Lieutenant Bishop, this letter serves as official notification that the complaint filed against you by Dr. Marcus Hale has been permanently expunged from your professional record. Additionally, the board has issued formal censure against Dr. Hale for filing a frivolous complaint motivated by personal animus. Furthermore, the board wishes to commend your exemplary conduct during the investigation and your commitment to patient care excellence. Your actions serve as a model for medical professionals across the state. Respectfully, Dr. Ellen Casper, Chairperson, State Medical Board. Sarah closed the email, leaned back in her chair, and allowed herself one moment of quiet satisfaction. Then her phone rang. Bishop. Lieutenant, it's Colonel Matthews. We have a situation developing at Fort McCready. Mass casualty training exercise went sideways. 17 injured, 3 critical. Can you get there by tonight? Sarah looked at her calendar. Disaster preparedness meeting at 2. Training session with residents at 4. Department review at 6. She could cancel all of it, or she could send someone else. She had a team now. Authority. The ability to delegate. But the question wasn't whether someone else could go. It was whether she should. I'll be there by 8, Sarah said. I knew I could count on you. The call ended. Sarah grabbed her go bag, always packed, always ready, and headed for the door. Patricia caught her in the hallway. Going somewhere? Fort McCready, Military emergency. Of course you are, Patricia smiled. Be safe. Always am. Sarah made it to the parking garage before Nina intercepted her. I heard you're going back to McCready. Can I come? Sarah stopped. Why? Because I want to learn. Because watching you work changed how I think about medicine. Because Nina took a breath. Because maybe I want to be useful too. Sarah studied her, saw the determination, the hunger, the same restless need to be more than adequate. She'd been exactly the same at Nina's age. You'll need to get DOD clearance. It'll take time. I'll start the paperwork tonight, and you'll follow my lead. No questions, no debate. When things get bad, I need to know you'll do exactly what I say. I will. Sarah nodded. Then let's go. They drove through the night toward Kansas, toward soldiers who needed help, toward the endless work of keeping people alive. And somewhere behind them, Langston City kept spinning, a hospital full of people who'd learned that the quietest voice in the room was sometimes the one worth listening to. That credentials meant less than competence, that ego was the enemy of excellence, and that Lieutenant Sarah Bishop, once dismissed, once underestimated, once invisible, had become exactly what she'd always been. Someone who showed up when it mattered, someone who did the work, someone who saved lives. Not because she needed recognition, but because lives were worth saving. And in the end, that was the only truth that mattered. The highway stretched ahead in the darkness, and Sarah Bishop drove toward the next emergency with Nina beside her, ready to teach what she'd learned the hard way. That sometimes justice arrives slowly, that sometimes the quiet win, and that sometimes, just sometimes, being underestimated is the greatest advantage you'll ever have. Because when nobody expects you to be extraordinary, extraordinary becomes easy. Fort McCready appeared in their headlights like a memory Sarah had tried to bury. Guard towers silhouetted against the pre-dawn sky, razor wire glinting in the security floods, young faces checking credentials with the same nervous intensity she remembered from her own deployments. Nina was quiet in the passenger seat, had been for the last hour. Sarah could feel the tension radiating off her, not fear exactly, but the anticipation that came before stepping into something you couldn't predict or control. You okay? Sarah asked. Yeah, just thinking. About? Nina turned to look at her. About whether I'm ready for this. Sarah drove through the checkpoint, showed her credentials, waited for the gate to rise. Nobody's ever ready. You just show up and do the work anyway. They parked outside the medical facility as medics rushed past carrying equipment. Inside, the controlled chaos was already underway. 17 casualties from a training accident, triage stations set up in the main bay, surgical teams preparing for the worst. Colonel Matthews found them immediately. Lieutenant, thank you for coming. Her eyes flicked to Nina. Who's this? Dr. Nina Reeves, resident from Riverside. She's here to observe and assist where appropriate. Matthews nodded. Welcome, Doctor. Stay close to Lieutenant Bishop, and you'll learn more in one night than most residents learn in a year. She turned back to Sarah. We've got 3 criticals, 2 with penetrating shrapnel injuries, 1 with crush trauma from equipment failure. The rest are stable or minor. Your call on priority. Sarah was already moving toward the triage area. The first critical was a 20-year-old private named Jackson, shrapnel through the right thigh, femoral artery compromised, bleeding controlled with a tourniquet, but pressure dropping steadily. The second was a sergeant named Lou, blast pattern burns across her torso and suspected lung damage. The third was a specialist named Rodriguez with both legs pinned under debris for 40 minutes before extraction. Classic crush syndrome waiting to kill him the moment they started fluid resuscitation wrong. Sarah assessed all 3 in under 2 minutes. Jackson goes to OR1 immediately. That artery needs repair now or he loses the leg, she pointed to Lou. Chest tube first, then imaging to rule out pneumothorax. If her lung collapsed, she crashes during surgery. Then Rodriguez. He needs aggressive hydration and continuous cardiac monitoring. When you release a crush injury, all that dead tissue dumps potassium into the bloodstream. His heart stops if we're not watching. The trauma team stared at her. Move, Sarah said. They moved. Nina followed Sarah into the OR, where Jackson was being prepped. The anesthesiologist was already establishing lines, the surgical nurse laying out instruments. You scrubbing in? Nina asked. Not unless they need me. This is Major Rourke's show. Sarah pulled on gloves anyway. But I'm staying close. Rourke entered the OR looking significantly less hostile than their last encounter. He nodded to Sarah. "Lieutenant, glad you're here. Let's save this kid." The surgery took 90 minutes. Rourke worked methodically, exposing the damaged femoral artery, repairing the tear, checking for additional injuries. Sarah watched from the side, occasionally offering observations that Rourke accepted without argument. "Distal pulse is weak," she noted. "Might have a clot forming below the repair site." Rourke checked, found the clot, cleared it. "Good catch." When Jackson's vitals stabilized and the wound was closed, Rourke stripped off his gloves and turned to Sarah. "I owe you an apology. For last time. For questioning your expertise." Sarah shook her head. "You were protecting your patient. Nothing to apologize for." "Still, you were right, and I was slow to see it." He paused. "I read your service record after you left. 3 Bronze Stars, 2 Army Commendation Medals, 17 documented saves under combat conditions." He met her eyes. "I spent 20 years being the expert in the room. Took me too long to recognize someone who actually earned that title." Nina was watching this exchange with wide eyes. Sarah just nodded. "Jackson's going to be fine. Keep an eye on compartment syndrome over the next 48 hours. Already on it." They moved to the next patient, then the next. By the time the sun rose over Kansas, all 3 critical casualties were stable. The remaining 14 were treated and recovering, and Sarah was running on fumes and muscle memory. Matthews found her in the break room drinking coffee that tasted like burnt dirt. "All patients stable. No losses." "That's a hell of a night's work, Lieutenant." "Team effort." "Maybe, but we both know who called the critical decisions." Matthews sat down across from her. "I want to talk to you about something." Sarah waited. "The Pentagon is creating a new rapid response medical team. Elite combat medics and trauma surgeons who deploy to crisis situations, military or civilian, anywhere in the country. 12-person roster. I want you to lead it." Nina, sitting nearby, went very still. Sarah set down her coffee. "Lead it? Full-time position, based out of Fort McCready, but deploying as needed. You'd have complete authority over team selection, training protocols, operational decisions. It's the job you've been doing anyway. We just want to make it official." "What about Riverside?" "You'd have to resign. This is active duty, not consulting." Matthews leaned forward. "I know that's a big ask. You've built something important there. But Sarah, this team could save hundreds of lives, maybe thousands, and there's nobody better qualified to run it than you." Sarah looked at Nina. "What do you think?" Nina blinked. "Me? I'm just a—" "You're someone whose opinion I value. So what do you think?" Nina took a breath. "I think it's an incredible opportunity. I think you'd be amazing at it, and I think—" She hesitated. "I think Riverside would survive without you, but the question is whether you can survive without Riverside." Sarah felt something shift in her chest. Matthews stood up. "I don't need an answer today. Think about it. Talk to the people who matter, but know that the offer stands as long as you want it." She left them alone in the break room. Nina spoke first. "Are you going to take it?" "I don't know." "Do you want to?" Sarah thought about the surgery, about the clarity that came from working in high-stakes situations where every decision mattered, about the part of herself that had come alive the moment she walked into that military OR. "Part of me does." "And the other part?" "The other part remembers what it cost the first time. 3 tours. 3 years of watching people die, of carrying bodies, of coming home and not recognizing the person in the mirror." Nina's voice was quiet. "You're different now." "Am I?" "You have people, a team, a purpose beyond just survival." Nina smiled slightly. "You're not alone anymore. That changes things." Sarah looked at her coffee, at the young resident who'd become something close to a friend, at the choice in front of her. "I need to go home," she said. "Talk to some people. Figure out what the hell I actually want." "That sounds like a good plan." They drove back to Langston City in silence. Nina dozed off around the 3-hour mark. Sarah drove through the early morning, watching the sun climb higher, thinking about everything that had brought her to this moment. Back. Riverside General looked different when Sarah walked in 3 days later. Not physically. The same building. The same trauma bay. The same coffee-stained break room. But different in the way people looked at her. the respect, the recognition. Patricia found her at the nurses' station. Heard about Fort McCready, 17 casualties, 0 losses. That's impressive even for you. Team effort. It always is with you. Patricia studied her face. But something's different. What happened? Sarah told her about Matthew's offer. Patricia listened without interrupting. When Sarah finished, she was quiet for a long moment. Are you going to take it? I don't know. That's why I came to talk to you. You want my advice? I want your honest opinion. Patricia leaned against the desk. My honest opinion is that you've spent your whole life being who other people needed you to be. Combat medic, because soldiers needed saving. Civilian nurse, because you thought you were done with the military. Director, because Riverside needed leadership. She paused. Maybe it's time to be who you need you to be. I don't know who that is anymore. Then figure it out. But don't make this decision based on obligation or guilt or what you think you owe anyone. Make it because it's what you actually want. Sarah felt tears prick her eyes, blinked them back. When did you get so wise? 23 years in this hospital? You learn things. Patricia squeezed her shoulder. Whatever you decide, I'm proud of you. We all are. That evening, Sarah visited Sergeant Torres at his apartment in Langston City. He'd been discharged from the VA hospital 2 weeks earlier and was slowly rebuilding his life. Physical therapy 3 times a week, online classes toward a degree, plans for a future that almost hadn't existed. He answered the door with a smile. Lieutenant, wasn't expecting you. Sorry to drop by unannounced. I needed to talk to someone. Torres stepped aside. Come in. His apartment was small but neat, military habits dying hard. Photos on the wall, books on the shelves, a life being constructed piece by piece. They sat at his kitchen table. Sarah explained the Pentagon's offer. Torres listened. Then he asked the question nobody else had. What scares you more, taking the job or turning it down? Sarah hadn't expected that. I don't know. Yes, you do. You just don't want to say it out loud. Sarah looked at her hands, at the scars she'd accumulated over the years, burn marks from touching hot instruments, cuts from broken glass, the permanent stain of iodine under her fingernails. Taking it scares me more, she admitted, because I know what that world does to people, how it uses you up and spits you out, how hard it is to come back once you're gone. Torres nodded slowly. You know why I joined the military? Why? Because I wanted to matter, to do something bigger than myself, to look back at my life and know I made a difference. He smiled sadly. And then I almost died in a training accident and realized that mattering doesn't require a uniform or a rank or a special team. It just requires showing up and doing the work. That's what I've been doing at Riverside. Exactly. And it's important work, real work. He leaned forward. But here's the thing, Lieutenant. You saved my life, and ever since I've been asking myself what I'm supposed to do with it, what purpose I'm supposed to serve with the time you gave me. You don't owe me anything. Maybe not, but I owe it to myself to be useful, to take what happened and turn it into something that matters. Torres met her eyes. You've got the same choice. You can stay at Riverside and do important work helping hundreds of people, or you can lead this team and potentially help thousands. Neither one is wrong, but one of them is calling to you louder. Sarah's throat tightened. How do you know? Because you wouldn't be asking the question if you didn't already know the answer. Sarah spent the next week in a fog of indecision. She ran training drills at Riverside, updated protocols, met with administrators and DoD liaisons, did all the work that had defined her life for the past 6 months. And the entire time, she felt like she was watching someone else's life. Nina cornered her in her office on Friday afternoon. You're leaving, aren't you? Sarah looked up from the disaster preparedness report she'd been pretending to read. I haven't decided. Liar. Nina sat down. I can see it in your face. You've already made the choice. You're just trying to convince yourself it's the right one. And what if it's not? Then you come back. You make a different choice. You adjust. Nina smiled. That's what you taught me. That adaptability matters more than perfection. Sarah closed the report. If I leave, Riverside loses the combat trauma program, the DoD contract, everything we built. No, they lose you. The program continues. I'll make sure of it. You're a second-year resident. Then I'll recruit third years, attendings, whoever it takes. Nina's expression was fierce. You gave us the tools. You showed us what's possible. Now you need to trust us to carry it forward. I do trust you. Then stop using us as an excuse to avoid the thing you actually want. The words landed like a punch. Sarah stood up, walked to the window, looked down at Langston City stretching in every direction. I spent 3 years in combat zones, she said quietly. Saw things I can't unsee. Did things I can't undo. And when I came home, I swore I was done with that life. That I'd never put myself back in situations where split-second decisions determined who lived and died. But you miss it. I miss the clarity, the purpose, the feeling that every single thing I did mattered in the most fundamental way. Sarah turned back. Is that selfish? No, it's human. Nina stood. Look, I don't know what the right answer is, but I know you're miserable pretending to be satisfied with safe. You're a combat medic, Sarah. It's not what you do, it's who you are. And trying to be someone else is killing you slowly. Sarah felt tears on her face, didn't try to hide them. I'm scared. Good. Fear means it matters. Sarah submitted her resignation to Raymond Cross on Monday morning. He took the news with more grace than she expected. I can't say I'm surprised. The Pentagon offer is extraordinary. You'd be foolish not to take it. I'm sorry to leave Riverside in the lurch. You're not. You built something sustainable here, trained people who can carry it forward. That's the mark of real leadership, knowing when to let go. Raymond extended his hand. It's been an honor working with you, Lieutenant. Sarah shook it. Thank you for believing in me when nobody else did. I think you'll find quite a few people believed in you. They just needed permission to say it out loud. Her last day at Riverside General was chaos wrapped in sentimentality. The trauma department threw her a surprise party, cake and awkward speeches, and Nina crying while trying to pretend she wasn't. Patricia pulled her aside near the end. You're doing the right thing. How do you know? Because you look alive again. Like the weight you've been carrying just got lighter. Patricia hugged her. Actually hugged her. Go save the world, Lieutenant. We'll hold down the fort here. Sarah walked out of Riverside General for the last time as the sun was setting. Got in her car, drove home through familiar streets that already felt like someone else's memory. And for the first time in months, maybe years, she felt at peace with the choice she'd made. Fort McCready in spring was marginally less desolate than Fort McCready in winter. Sarah reported for duty on a Monday morning with a duffel bag and a clear sense of purpose. Colonel Matthews met her at the training facility. Welcome to the Rapid Response Medical Team, Lieutenant. Your team's waiting inside. Sarah walked into the briefing room and found 11 faces staring back at her. Combat medics and trauma surgeons, veterans and specialists, people who'd seen the worst and chosen to keep showing up anyway. Matthews made the introductions. Sarah listened, memorized names and specialties and deployment histories. Then Matthews stepped back. She's all yours, Lieutenant. Sarah stood at the front of the room, looked at the people she'd be leading into crisis situations, and told them the truth. I'm not here to be your hero. I'm not here to make you into heroes. I'm here to build a team that shows up when things are impossible and does the work anyway. She paused. Some of you have more experience than me. Some of you have better credentials. That's fine. What matters is whether we can function as a unit when a patient's life depends on us making the right call in the worst possible moment. One of the surgeons, a major named Williams, spoke up. What makes you qualified to lead us? Fair question. Nothing makes me qualified, but I've spent the last year learning that expertise isn't about credentials or rank. It's about showing up, making decisions, taking responsibility for the outcomes. Sarah met his eyes. I'm here because I'm willing to do that. If you're not, there's the door. Nobody moved. Williams smiled slightly. Fair enough. The first deployment came 3 weeks later. Tornado outbreak in Oklahoma. Multiple hospitals damaged. Mass casualties. Infrastructure collapse. The team loaded into transport planes and flew into chaos. For 72 hours, Sarah barely slept. She coordinated triage across 4 different medical centers, performed emergency surgeries in makeshift ORs, trained local staff in combat trauma protocols when their own systems failed, And through it all, her team functioned like a single organism, anticipating needs, covering gaps, executing with the precision that came from trust and training. When it was over, they'd treated 347 patients, lost 2. Sarah stood in the parking lot of a destroyed hospital, watching the sunrise, and felt Major Williams approach. "Hell of a deployment, Lieutenant. Hell of a team. You were right about showing up, about doing the work." He paused. "I thought you were too young, too untested. I was wrong." Sarah smiled, tired but genuine. "Happens to everyone eventually." Pop it. Over the next year, the team deployed 17 times. Hurricane relief in Florida, industrial explosion in Texas, mass shooting in Colorado. Each deployment was different. Each one pushed them to their limits, but they showed up every single time. Sarah led from the front, making the hard calls, taking the risks, carrying the responsibility. And somewhere in the endless cycle of crisis and response, she found something she hadn't expected. She found herself, not the quiet nurse who disappeared into hallways, not the combat medic running from her own memories, just Sarah Bishop, leading, serving, using her skills to make a difference in ways that actually mattered. Yelek. On the 1-year anniversary of her deployment, Sarah received an unexpected letter. The return address said Colorado. The handwriting was unfamiliar but careful. She opened it in her quarters at Fort McCready. "Dear Lieutenant Bishop, you don't know me, but I'm Jennifer Hale, Marcus's ex-wife. I'm writing because Marcus asked me to. He's been in treatment for 14 months now. He's sober. He's working as a surgical consultant at a rural hospital in Colorado, teaching residents and trying to rebuild a career he destroyed. He wanted me to tell you that he watches your deployments on the news, that he's seen the work your team does and understands now what he couldn't understand before, that being the best means putting patients above ego. He also wanted me to tell you that he's grateful for stopping him that night at Riverside, for showing him what medicine is supposed to look like, for being the kind of professional he should have been all along. He doesn't expect forgiveness. He doesn't deserve contact, but he wanted you to know that the person you were, quiet and competent and focused on the work, changed his life. Thank you for being better than the people who tried to break you. Respectfully, Jennifer." Sarah read the letter twice. Then she wrote a response. "Jennifer, tell Marcus I'm glad he's found a path forward. That recovery is hard and I respect anyone who does the work. Tell him I don't forgive him. Maybe someday, but not yet. What he did was cruel and wrong and it cost me months of my life I'll never get back. But tell him I hope he's learned something, that humiliating someone doesn't make you stronger. It just reveals how weak you already were. And tell him that the quiet people he dismissed are often the ones who change the world, because they're too busy doing the work to waste time on ego. Sarah Bishop." She mailed it the next day and never thought about Marcus Hale again. Bolkats. 2 years after joining the Rapid Response Medical Team, Sarah stood in front of a Senate subcommittee explaining why funding for the program should be increased. She'd become something she never expected, an advocate, a voice for combat trauma medicine and disaster preparedness, someone people actually listened to. The hearing lasted 3 hours. Senators asked questions about protocols and budgets and outcomes. Sarah answered every single one. At the end, the chairperson, a stern woman from Virginia, leaned forward. "Lieutenant Bishop, you've built an extraordinary program. Your team has saved countless lives. What do you credit for your success?" Sarah thought about the question, about Riverside General, about Marcus Hale, about every moment that had led her to this chair. "I credit the people who underestimated me," she said, "because being underestimated taught me that credentials don't matter as much as competence, that titles don't matter as much as trust, and that the quietest voice in the room is sometimes the one worth listening to." The chairperson smiled. "Well said." The funding passed unanimously. Take. On her 3rd anniversary with the team, Sarah received a commendation from the Surgeon General. The ceremony was small, just her team, Colonel Matthews, a few Pentagon officials. But Nina Reeves was there. She'd finished her residency, taken a position at Riverside, built the combat trauma program into something even more comprehensive than Sarah had imagined. They hugged in the hallway after the ceremony. "I'm proud of you," Sarah said. "I learned from the best. You learned from someone who was too stubborn to quit, That's different. Nina laughed. Maybe, but it worked. They talked about Riverside, about the team, about lives saved and lessons learned. And when Nina left to catch her flight back to Langston City, Sarah stood alone in the Pentagon corridor and realized something fundamental. She wasn't invisible anymore. She wasn't quiet. She was Lieutenant Sarah Bishop, combat medic, team leader, someone who'd been broken and rebuilt and refused to let the breaking define her. And that was enough. More than enough. Sarah's phone rang late one night while she was reviewing deployment protocols. Unknown number. She almost didn't answer, but something made her pick up. Bishop? Lieutenant Bishop? This is Sergeant Michael Torres. Sarah sat up. Torres, it's been a while. How are you? Good. Really good, actually. His voice was warm, happy. I graduated, bachelor's degree in emergency management. I'm working for FEMA now, coordinating disaster response. That's incredible. It's because of you. What you did, saving my life, it gave me a second chance, and I wanted to use it for something that mattered. He paused. I'm calling because I'm getting married next month. Small ceremony, just family and a few people who made a difference. I know it's a long shot, but I'd be honored if you could come. Sarah felt her throat tighten. I'd love to. Really? Really? Torres laughed, relief and joy. Thank you, Lieutenant. You being there, it would mean everything. The wedding was beautiful. Small church in Kansas, spring flowers. Torres in a suit looking healthier and happier than Sarah had ever seen him. During the reception, he pulled her aside. I never thanked you properly for giving me a future. You thanked me plenty, not enough. Torres met her eyes. You saved my life. But more than that, you showed me what it means to use your skills for something bigger than yourself. To be useful, to matter. Sarah smiled through tears. You were always going to matter, Torres. You just needed the chance to prove it. We all did. That's the thing you taught us. That being underestimated doesn't make you less. It just means you get to surprise people. Sarah Bishop stood on the tarmac at Fort McCready, watching her team load equipment for their next deployment. Earthquake in California, hundreds injured, hospitals overwhelmed. They'd wheels up in 20 minutes. Colonel Matthews approached. Ready, Lieutenant? Sarah looked at her team, at the people who trusted her to lead them into impossible situations, at the work waiting for them in California. Always. That's what I like to hear. Sarah climbed into the transport plane, strapped in, closed her eyes, and thought about the journey that had brought her here. From combat zones to civilian hospitals, from invisible nurse to respected leader, from someone people dismissed to someone they called when everything fell apart. She'd been humiliated, investigated, challenged, broken. And she'd survived it all, not because she was perfect, not because she never made mistakes, but because she showed up, because she did the work, because she refused to let other people's limitations become her own. The plane's engines roared to life. Sarah opened her eyes. California was waiting. People who needed help, lives to save, work that mattered. And Lieutenant Sarah Bishop, once quiet, once invisible, once underestimated, was exactly where she belonged. Leading from the front, making the hard calls, proving every single day that the person nobody noticed was the one who changed everything. Because in the end, that's what mattered. Not the medals or the recognition or the vindication, just the endless, unglamorous, life-saving work of showing up when things were impossible and being good enough to make the impossible routine. The plane lifted into the sky. Sarah Bishop smiled and got back to work.